Hi, my name's Jo Viney. Welcome to The Dish. We decided that we would use nature and learn from nature. Right now, those people are in high demand. Yeah, so the story is really, really important.
Here's what I promised, here's what I delivered. Welcome to The Dish, where we invite entrepreneurs to share their insights into the next generation of biotech companies. I'm Johannes Fruehauf, founder and chairman at LabCentral and CEO of Biolabs. After more than a decade of working with entrepreneurs and supporting more than 1,200 startups, I'm here to bring you stories from our ecosystem. Are you ready to dish? Hello everyone and welcome back to The Dish. Today we're excited to be joined by Dr. Jo Viney, co-founder and CEO of Seismic Therapeutics. With over 30 years of immunology and drug development experience, Jo has founded several biotech companies, among them Pandion, which was here, and acquired by Merck for $1.8 billion. At Seismic, Jo is leading efforts to integrate machine learning with structural biology and protein design to develop novel biologics. By leveraging AI, Seismic aims to accelerate and enhance the drug discovery process. Jo, welcome.
Thanks so
to
much.
The show.
Pleasure to be here.
We always start our conversation with our guests here by asking you to bring an orange object. You know, LabCentral loves orange, and thank you.
I love orange too.
Did you bring something for us? What did you bring?
Well, it was a little bit tricky. It took me a few weeks to think of something. So having started 3 companies here, as you just mentioned, I tried to think about what was it that I cherished about LabCentral. And after a little while, I was thinking maybe it was the lab space here, maybe it was the networking, but I still couldn't come up with anything orange. So then I decided to go down a different route altogether and think about, well, could I bring something British? Mm-hmm. And I still got stuck. But then I came up with an amazing idea. And this is what I thought of, something that combines the lab, the networking, and something British. So, Johannes, I don't know if you know anything about the history of PIMS. It was first invented in, I think it was about the 1840s in England, by someone who owned an oyster restaurant, and it was to really aid digestion. Mm-hmm. But the recipe has remained secret for all of these years. No one knows the recipe.
You have not yet reverse engineered it?
No, no one has been able to reverse engineer it. And it made me think it was a little bit like the labs here, where we're all working on something new, novel, innovative, but we have to keep our secrets to keep differentiated. So that's sort of the lab piece. Obviously, coming from Britain and from London, it's very British. It's very popular in the south of England, which is where I'm from. It's the #1 drink at Wimbledon. More than 80,000 pints of PIMS are drunk at Wimbledon each year. So it's a very popular drink. So I thought it represented me, as a Brit. And obviously, it's a gin-based drink, so it's really good for helping the networking.
Let's try this out. Cheers. Pretty good. I don't know if I can keep doing this and continue with your interview. Let's see.
We'll network.
We'll find exactly. So, Jo, you've now founded 3 companies. The most recent, or the biggest currently, is Seismic. What made you say yes to yet another company?
Well, I guess I'll reframe the question a little bit and talk a bit about how I made the transition from big biotech to the startup world. And I spent most of my career, 20-odd years, in the big biotech space at Biogen, Amgen, Immunex, and I loved every minute of it. I really learned how to do drug discovery. I really learned about the challenges of how to bring new therapies to patients, and I really enjoyed the thrill when a patient was dosed and actually had benefit from the drugs I'd made. But what I was really looking for when jumping to the startup world, and it was really being in this sort of Boston ecosystem, what I was really looking forward for was being at the forefront, or more of the forefront, of innovation. So in a large company, I'd reached a senior position, and so my days were spent looking at PowerPoint presentations, and no one wanted to hear anything I had to say about designing an experiment. Mm-hmm. So I thought that the startup world would get me really closer to that sort of forefront of innovation. I was really intrigued about the fast pace of the startup companies. So one of the things that I had observed was the pace with which investors want new ideas, new results, and that really excited me. I really sort of thrive in that sort of environment. And then the last bit was really the culture. So I had really spent most of my career thinking a lot about culture, and joining the startup world gave me a greater opportunity to really mold the culture. So it's really those three things: innovation, fast pace, and culture.
And we saw you do that masterfully at Pandion. That was really great. And I know you're doing it again at Seismic.
Oh, thank you.
Yeah, well, it's great to see. So Seismic uses AI to engineer proteins. And what does that actually look like in practice? How do you go about designing proteins in the computer, and what do your teams look like?
Yeah, so it's, well, maybe we'll start with what do you usually do in the traditional drug discovery process. So
What's
usually,
different? Yeah.
so usually you think about the biology that you want to intercept, and you run a screen so that you can find something that alters the function. And then once you've found the protein that can alter the function, you then have to turn it into a drug. You have to figure out what are the drug-like properties, how to make it suitable for repeat dosing, etc. And that process usually takes 3+ years. So at Seismic, we're using machine learning to really help us accelerate how to do that. So instead of in series making all of these mutations to get from our hit to our development candidate, we can run all of that in parallel. It's really a process called parallelization. And so we can look at the functional activity, we can increase stability, we can decrease viscosity, we can remove chemical liabilities, we can remove immunogenic epitopes, and we can do all of that simultaneously. And so instead of multiple design and test cycles, we've really reduced the number of design test cycle times. So that really shrinks the time frame that it takes. So instead of the 3+ years, it really, the first 3 programs we've worked on have all been 18 months from hit ID to development candidate nomination. So that not only saves time, but obviously also saves money, saves resource, and also means our people can really be thinking about the more innovative aspects of drug discovery.
In the process of designing your drugs in the computer and then testing them in the lab, can you talk to us about how you integrate your teams? I imagine those are different people, right? You have a biologist and you have a computer scientist or a computer engineer. How do you integrate those?
Yeah, so the integration's really, really key. So at the outset, when we first were founding Seismic and thinking about using machine learning, which 3.5 years ago, machine learning and protein engineering and protein therapeutic drug discovery were not exactly commonplace. They're very commonplace now, but 3.5 years ago they were not. We felt it was really important to integrate the machine learning scientists as part of our drug creation team. And so our machine learning scientists sit side by side on the project teams with our biologists and with our protein engineers. And actually our most recent development candidate, the co-lead of that program, was a machine learning scientist who had never worked on drug discovery or development before. So really important to make sure that you don't have things tossed over the transom and you actually have people truly integrated within the drug creation team.
Where do you find those people? Where do you find the people that can talk both languages?
Yeah, it's right now those people are in high demand. I think that we've seen an explosion of machine learning in many different aspects, not just drug discovery, but actually also in tech and in society in general. We are looking for very special people who really have a desire to want to bring new medicines to patients. And I think those are the machine learning scientists who really do well in our environment. Not just those who want to code, but those who want to code because they can really see a vision of what they can do to patients.
So these are amazingly powerful tools, right? And they will likely change the way we do drug development. It goes faster. We select patients more directly. Why do you think that more biotech companies aren't using these tools yet? What's holding them back? What's holding us back as a field?
Yeah, I think there's probably more companies and even in academia using machine learning than we think. But I think the challenge with developing drugs to get to patients is that it's still a complex process. And you really need that drug discovery and development background in order to understand the best way to apply machine learning. So one of the things that isn't so useful is developing machine learning or artificial intelligence tools like a hammer and then going in search of nails to hammer them in. that's not the best way to really think about that direct application. So we start the other direction and start thinking about what's the unmet need, what are the pathways that we want to intervene in, how do we think about creating that initial prototype, and then applying the machine learning to get from that hit identification stage to the development candidate nomination. But I think a lot of people are using it. At Seismic, we've decided to embed it as part of our way of life, and I think that's really been the fruit that has yielded, it's been really the approach that's yielded the fruit of our 3 development candidates in 3 years.
What are you feeding your algorithms with? Or are you using other people's databases so that they can be useful for your science?
Yeah, so interestingly, there's a lot of talk about what are the data that's used for machine learning algorithms. We decided that we would use nature and learn from nature to build our therapeutics, because that's really the closest way, we thought, for getting our therapeutics into patients. And so we use the publicly available databases, whether that's antibody databases, structural databases, protein databases. One of the programs we work on is a protease, and so we use all of the sequence and structure information for all of the proteases that exist in the world. And that's really helped us think 3-dimensionally about how we engineer our proteins to keep the function that we want, but to get the drug-like properties that we want.
Do you feed your results back into your same?
Oh, absolutely.
Algorithm?
So I mentioned we have like a design test cycle process, and so it's really important that, I wish 100% of our designs were accurate at the outset. They're mostly accurate, but we do generate data in the wet labs, and that's a very important part of really further training our machine learning algorithms, is to feed that data back in so that we can get better and better and better. Much like practicing your run around the block.
Right. So after Pandion's acquisition and Seismic's current success, you've clearly learned how to break down and tell the story, and also raise money in sometimes difficult markets. What can you share about telling the story to investors and delivering value?
Yeah, so the story is really, really important. And I think that comes down to really mapping out a very thorough business plan. And when I say business plan, that really has 2 parts. So one is the value proposition, that's the first part, and the other is the roadmap. So when you think about your business plan and the value proposition, you really have to articulate the landscape, describe the landscape. What's the unmet need? What are the competitor drugs that are available? Why you think that there's an opportunity here. So that's sort of the first part of the value proposition, is that landscape painting. And then the second part of the value proposition is, what problem are you trying to solve? And why are you uniquely able to solve that problem? What's the technology that you're using? What is it about your people that help you solve that? So that's really sort of part one, is the value proposition. And then the second part is having a really clear roadmap. And what do I mean by roadmap? Really, it's the articulation of how long will it take and how much will it cost. And so that's really the key part for investors. They want to know clearly up front, how long are they signing up for and how much money are they going to have to put in. And I think that those are the sort of 2 main elements of the business plan that really, if you have that and you think about basing your story around that business plan with the value proposition and the roadmap, I think it's the clearest way to tell the story that is understood by investors.
We should probably have you back for an episode just about storytelling and show a Gantt chart in the back. And here's what I promised, here's what I delivered.
Yeah, and then for fundraising, it's always hard. I sort of use the 4 Ps for fundraising, and you might ask, what are the 4 Ps? So it's really plan, products, people, and pavement. And so for the plan, I've just articulated what's the business plan, what's the value proposition, what's the roadmap. Really important to help investors understand what they're getting into. And then it's product, and the product could be a platform or it could be the actual products. You really need to help investors understand what is the return on investment that they should expect. And you want to be clear about that so that they don't end up being disappointed. So that's really the product side of it. The people, obviously you need a good team. You don't have to have everyone as part of your company, but you do need to have identified consultants who can help you and sort of fill your gaps. And investors want to see that the team can work well together because this is a hard business. In an ideal world, all of our ideas would be straightforward and work. They don't, so they want to know that teams are going to be resilient enough to work together. And then pavement, that's really a lot of pounding the pavement. Fundraising is hard. You have to have a lot of tenacity. You have to knock on a lot of doors. You have to be very, very, very tenacious about getting there. And that's really dictated a lot by the external markets. And, you know, as we've seen in the last few years, investors are risk off at the moment. And so you really have to think about how do you pitch that story in this risk off environment and get people comfortable that what they're investing in is something that's likely to return something from the investment. You know, there are other times the pendulum swings, and sometimes there's a lot of interest in far-fetched, far-flung science, and you really would have to sort of think about pivoting your story to sort of meet what the external landscape is expecting.
So, Jo, thank you. That was amazing. We like to wrap up with a question that goes back in time. If you had a chance to talk to your younger self at 18, 19, 20 years old, Jo, what would you tell that young person? What advice would you give them?
That's a good question. I think I would start by saying make sure you jump on all those opportunities that present themselves. So one of the things that really got me into medical research or scientific research and ultimately into biotech was by chance doing an internship at St Bartholomew's Hospital Medical School in London when I was an undergrad in the pediatric gastroenterology department. And my first day there was rather a challenge. I watched an endoscopy and passed out, but it really made me understand the proximity to wanting to help patients. So that's really the first piece of advice, jump on opportunities. My second piece of advice really would be to don't be afraid to jump into areas where you feel a little bit like a fish out of water. When I started my career, there were many more men than women in leadership positions. I really didn't have a role model, and it would have been easy to give up. But actually, I persevered, and actually now spend a lot of my time encouraging others to put a helping hand down to get others on that rung. So that would probably be my second piece of advice, like go for it, don't be intimidated, but make sure you actually also bring people along, the next generation along behind you. And then the third piece of advice I would give myself is don't just survive, but thrive. And so whenever people are talking to me about different opportunities they have for new roles and which position should they take, I always advise them to really think about where do they feel most comfortable. Because at the end of the day, this is a career that really requires a lot of personal investment, and you want to be doing it and spending time with people who you really enjoy being with. So think about thriving, not just surviving.
That's wonderful advice. Thank you. So thank you so much, Jo, for talking to us today. And it was great learning from you and hearing about Seismic and Pandion and your own journey. Thanks for sharing with us.
Oh, you're
and thank you in the audience for watching, and we hope to see you back in the next episode of The Dish. Cheers.
Cheers.